Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. So good morning, Dr. Mencia.
Good morning,
Anita.
Anita.
That sunrise?
Oh, it's so beautiful. You know, when I was driving here, it was so dark. Just riding on top of the station. I mean, it was light coming from Broward. And then as you got closer and closer to the station, it was darker and rainy and what have you. But look at now, the sun out.
It always comes out,
Welcome
right?
to Florida.
Yeah, when you wake up, it's the funniest thing that I see a lot of people with their blinds down. And when I wake up, my blinds are open and the light comes in no matter what time it is. Even if it's dark outside, there's still enough light. I guess I'm a light person. Some
people are dark person.
They like that, don't
like
they?
Darkness, yes. I remember.
You're a light person, and I know
I'm
that.
a light person.
Yes.
I love light.
That's why we love each other.
Yes, exactly. Yeah. That's
Let
why
the light come in.
Richard said he lost my tie because they
always
bling bling. He got to
bling,
put
bling.
on. He got to put on his sunglasses.
Yeah. So yeah, but
the article for the people that get the boomer time.
Yeah.
The boomer time is an excellent article by Dr. Ayala on Love Your Heart. It's going to be 2 parts. So if you get this part on this edition, please make sure you look for the next edition coming up next month. It's an excellent article to educate people on their heart.
yeah, the whole idea of a machine now, a test that can really foresee how you're going to do. That's what I loved about him.
Exactly. And, you know, some people think of heart disease. If you have a family history, then I have to be careful. But if my cholesterol is good, then I have no problems. And there are so many factors that comes together into heart disease. You know, your lifestyle. You know, you're a person that are active or passive. You're a couch potato. The sugar, you know, people with diabetes, and there's a commercial now that has been coming out. It's about a diabetic medication.
I saw that.
And they go about interviewing diabetic patients and say, you know, did you know that you can, you know, you are at risk of a heart disease? And people, it's a commercial, of course, it's all set up, but it's true. It's so true. A lot of people don't know that there is a correlation with diabetes and many other things. For example, a diabetic patient, if you have a stroke, you are more likely to have to be a bleeder than to have a schematic stroke, meaning a dry stroke.
And why is that?
We don't know. It's something with just the sugar and the way the blood vessels get affected by the sugar. They have a tendency of leaking blood through the blood vessel. So the person with diabetes are more prone to having kidney damage. They are more prone to having neuropathy on their extremity. They are more prone to blindness. They are more prone to glaucoma and cataract. They are more prone to stroke. So just having diabetes by itself, it's a high risk for heart disease, and people sometimes don't make the correlation or don't want to look at the correlation. So when, you know, sometimes we get patients that come to the doctor and they get told, you know, you have diabetes. Oh, I'll fix it. You know, we have
fix it. How are they going to fix it?
You know, we have a dietitian. No, it's okay. I'll do it myself. I say, okay, you know, it's covered by your insurance. No, it's okay. They don't want to put the time to get it fixed. And you have other people that they acknowledge, but they rather just take a pill. And there's only so many pills you can take to try to correct the problem. The beauty of diabetes, for example, you know, talking about diabetes and heart disease, the beauty of diabetes
There's a
is
beauty
that
in diabetes?
there is a beauty in diabetes. You know, diabetes is sweet. So there's a beauty there. The beauty in diabetes is that all the studies have demonstrated that if you can correct the sugar to a normal level, now listen to that, You bring the sugar to a normal level. That means that you behave like a non-diabetic now. Those persons, in all of the study that had been done through the history of medicine, those persons will never, ever develop complication of diabetes.
Really?
Right.
That's a new? Is that a new thing?
No,
You've
been forever. I mean, we've been known that, we have seen study in Europe and United States and Canada where people with diabetes, let's say, they don't require insulin, but they get put on insulin just to get a very well controlled, completely, absolutely unequivocal controlled sugar. And those people will never have any complication of diabetes. But you don't have to do it with insulin. That's a way of proving the fact that if the sugar is well controlled, you will never have any problem. We tend to play game with our numbers. We say, I'm just going to ignore this number. The sugar is 220 today. I know it's high. I know it's supposed to be around 90. Tomorrow I try to bring it down. And 220 is too high. It's 120 too high.
And how can they just bring it down? By not eating anything sugar?
Sometimes what people do, because they start handling their own diabetes, they think they can control it by, let's say, going on starvation for a day or two, and that's ignorant. That's stupid. Going on starvation, put your body on a starvation mode, which means that when you get hungry the next time, you're going to eat worse than what you would normally eat because your body is trying to defend itself. So going on a starvation is not an answer. Taking extra pills to bring the sugar down is not an answer. That's called yo-yoing with the blood sugar. So you get the sugar to go to 400, you bring it down to 86, and then you get all the signs and symptoms of low sugar. Then you start drinking Coca-Cola and eating a piece of pie to bring it back up, and now you go back to 200. So yo-yoing of the sugar, imagine what's going on through the tissue when the sugar is fluctuating up and down so much. So all of those things are bad. The best thing to do is, if you come to a center like ours, AGI, we have a few dietitians. We have 3 dietitians that work with us. One of them all 3 of them do some Saturday hours. So for people that cannot come on the weekdays, they can come on Saturday. They can come on Saturday and see the dietitian on Saturday. So you don't have to say, I got to take off from work to see the dietitian. Not true. No, right. AGI. AGI, you can say, no, give me a Saturday appointment. And Saturday, they stay there until the last patient. They are not on the way they are not rushing on the way out. They are really, dedicate their time. And Courtney at the Boynton office, she does.
Yeah, she's Saturdays. Yes, it's perfect.
Every Saturday almost she's there seeing patient. So you have all the dietitian available. You have Dr. Ramahan, who is a diabetologist. He's an endocrinologist that work at AGI. You have me. You have the other physician. You have the dental department to make sure you don't develop cavity and your mouth is well taken care of.
But wait, now stop with this. So if someone has diabetes, does it affect their mouth and their oral?
Absolutely, yes. Yes.
I don't know anything about that. Why don't you educate us on that?
Yeah, because imagine they are prone to gingivitis. They are prone to inflammation of the gingiva, and they can develop gingivitis, inflammation in the mouth, and that's why it's very important for a diabetic patient to see the hygienist. And when you see we have the hygienist and the manager that came over and did a show with us. And when you see one of the hygienists and they do the cleaning on you, by doing the cleaning, what they are doing is protecting the gum that is anchoring your teeth in place.
Really?
So if you get deep pocket, When you go to the hygiene and they say,
Yes.
oh, Anita, you are having some deep pocket.
Yes.
That means that the gingiva, the skin had detached from the gum. That's a deep pocket. And the more it detached, the looser the tooth will become. And then you're going to lose that tooth. So if they clean that up, they clean the deep pocket, it can reattach and protect your teeth. So normally we have bacteria in our mouth. We normally have bacteria. So what do we do in the microbiology lab when we want bacteria to grow? We take blood, we take sugar, and then we take the bacteria. We add the bacteria to this medium, and the bacteria will multiply very fast. That's what we do in microbiology. So when a person has let's say a bronchitis or upper respiratory infection, and we take a swab and send it to the lab, that's what they do with that swab. If you have a urine sample and you're going to culture the urine sample, we take the specimen and we put it on blood and sugar in a media,
and sugar.
and that will make the bacteria grow super fast. And then by the next day, we can tell what type of bacteria you have and what is sensitive to and what have you. So imagine being a diabetic and you have your normal flora, your normal bacteria in your mouth, but the sugar being too high make you prone for those bacteria to now overgrow and eat away at your gingiva. And create deep pocket, and you can lose your teeth and have cavities.
And imagine what it's doing to the rest of your body. As a matter of fact, I have a confession. I don't know, I guess Bill and I used to have fun doing something, sometimes at night. He'd buy a box of Good
Making
and Plenty.
love.
Yeah, besides,
making
yeah,
love.
before or after. Okay, Good and Plenty.
Yeah.
You know what they are, the little white and pink licorice inside.
Licorice, yeah.
So nothing would do, but I went the other day and I saw the Good and Plenty. I said, okay, I'm going to buy it, in memory. And I hid it in the filing cabinet where he used to keep it, and we'd be watching television. I say, do you have any of that? Yeah, okay. And he gave me 5. And I said, oh, aren't there any more? So I bought a whole box. And the other night I ate the entire box. I didn't want to. I kept putting it away. Now, I don't have diabetes and I eat pretty well. What did that do to me? It's gone. I mean, it's okay. I just ate the whole box and I felt fine afterwards.
Yeah.
That was not good, right?
Well, no, that's no good. That's no good. Because,
don't do it, right?
No. Because, Anita, see, what happened is that, let's say when a woman is pregnant, right? We do a sugar test. And it's a challenge. So what we do is we give the person concentrated sugar, high level of sugar, for the person to drink, and then we test the sugar in half an hour and a half, 2 hours. And if the pancreas was able to handle that challenge, that means you don't have gestational diabetes. If, in the other hand, the sugar went too high, that means that person, even though you are not a diabetic, you have, during pregnancy, you have gestational diabetes.
I've heard
As
of that.
we age, the pancreas function, the hormone, the insulin that come out of the pancreas will have a tendency of being less powerful. So if we go and take a challenge like what you did, you can, during that moment, you can just overshoot the insulin. And if the sugar got too high, eventually it will drop because you don't do this every day. But people that have a tendency of doing every night when they sit down to watch TV and they keep re-challenging the pancreas, they get to a point that you burn out the pancreas. So to do it once in a blue moon is a challenge, and it's not good to do. It's not the right thing to do.
Okay,
but
I'm
if
never
you do
doing
it
it again.
No, if you do it frequently, then it's really, really bad. It's really bad because, you don't want to challenge your pancreas.
I
like
understand. That was
Yeah.
a very good explanation. I will remember that now, right?
Yeah.
Yeah, instead, right.
And it's okay to eat something sweet, and
Right.
especially, during the daytime that you are up and about and active. But at night, watching TV is the worst time.
Now, this is great. So I hope our listeners just got it. This is a very important piece of information. So at night, eat I guess you can eat fruit. It's sweet, but you can eat blueberries or
You can
something
eat,
like that
you can
with
eat
some yogurt.
Right. The thing with the fruits and starches at nighttime is the volume. If the volume is too high, the pancreas is going to process that sweet and those starches, and it's going to absorb 100% of it. So it's going to go into storage as triglyceride or stay swimming around as sugar in your blood. Now, if you do it during the daytime, if you have dessert, let's say at lunchtime, what will happen is because you are up and about, you are active, you're going to burn some of those calories. So the body say, I don't have to storage, this fuel because the engine is cranking. So we're going to use it today. But if the engine is not cranking, it's just going to go there and stay and go into storage. So the worst time to eat sweet, that's why we say to person that want to lose weight, that want to correct the sugar, avoid sweet after dinner. Avoid sweet. Avoid eating less than at least 2 or 3 hours before you go to bed. That's when you want to have your last meal.
But you can have milk.
You can have milk, you can have tea, you can have water, but you don't want to have a heavy meal. Like some people, they work late, security guard and what have you, and they work late, and they get home at 11 o'clock, and they eat and they go straight to bed, and that's not a good thing to do. Get home, eat, but either sit down, watch TV, start cleaning the house, start fixing your clothes for the next day. Start doing things to keep you up and about, burning some of those calories before you go to bed. And you want to do for a good at least 2 hours before, hitting the sack.
So that's when I should mop my house and do all my things, right? Late at night?
Late at night.
But they say not to exercise before you go to bed.
You don't want to exercise. No, if you exercise, it's going to keep you awake. You just want to stay active if you have to eat late. Ideally, you want to eat early, and then 2 or 3 hours later, then bedtime. Ideally.
Wow. Yeah, this is
some
good
people,
information. I know,
some
but
people,
at least you tell them.
They work until late.
And they can't help it.
And they think there's nothing they can do. There's a lot of things we can do, even if we have the night shift, and we have to, to eat late at night. We can still avoid obesity and avoid diabetes.
Well, I think what I'll do is I'll start eating my flax seeds at night. I put my flax seeds in everything, but I'll have a couple of spoons of flax seeds.
I love my flax seeds. Yeah, and the salad and everything.
You really, I do it too. But I put flax seeds when I'm making my egg in the morning and all. But I now can actually take a spoon of flax seeds and eat them.
Mm-hmm.
And, there's actually candy that are full of those. No, it's sesame seeds. That's sesame what it is. I'm sorry. No, but it's a flax seeds. Well, let me give some information. Dr. Mencia told you that if you want to be healthy and you want to really know what's going on, go to his AGI Medical and Dental Centers. They're open on Saturdays. The one that a lot of you, if you want to get magazines, you can go there. They have all our Boomer Times. And they're at 1608 East Commercial Boulevard. And they're open, as I said, on Saturdays. And then if you want to go to Boynton Beach, you have to call. Let's give you the phone number to call in commercial, because then they'll tell you if the Boynton Beach is open and make an appointment. It's 954-489-1345. 954-489-1345. Home visit services are available. As a matter of fact, Dr. Mencia, you will see a little article in the New Boomer Times about doctors now see people at home, and not mentioning, it's a small article, but then I put you in the last paragraph. In fact, Dr. Andy Mencia does that. I didn't put, how to get in touch with you because it was an article, but I'm so proud of that. You do this. I can't tell you. I love the fact that you bit that bullet, because it's not easy. And then we have to talk about Stonewater Med Spa.
Stonewater, they are doing so well. Olga is doing a great job there with Claudia and Ina, supporting her, and they have made such a great team, these three ladies. So.
Yeah, but because it's beautiful, relaxing.
Gorgeous,
I'm still threatening to go there. I
went already.
Yes, sir, you told
I
me.
went.
But you didn't do the salt yet.
I didn't do the salt yet.
I know, I have to
did
do
the
the salt.
massage.
Did you do the water?
I got my hair done. I got my nails done. So I'm spoiled. I'm going to go back.
Yeah, well, people should be spoiled, and I think that's a good thing to discuss, too.
It's good to relax.
Yeah.
You need to put time aside and try to enjoy a little bit of yourself. So.
Well, there's more. When you go there, the people are very friendly, and you can tell them everything. That's the one thing I know. People who are they're retired and they were in the beauty business. They had stories. It's almost like they're psychologists there.
Right,
They listen, they talk, and that's very good therapy. Besides
Absolutely.
all the other things you do, the massage. Oh, you have a masseur, a massage therapist, the gentleman.
Oh,
I hear he's fabulous.
Yes, he's very good. He went to the expos, and
his name is Christian.
Christian. Yeah.
Yes, I saw him. It's funny. I always think of a massage therapist and a man as a big wrestler, but he's very small in a sense. He's thin. But
very
I've
thin,
been told he has some powerful hands.
That's what patients, clients say when they walk out of the room. You cannot believe how this thin man, like skinny like this man, has so much power in his hands, and they like it.
Yeah, no, he's very sweet. I know he did a lot at the expo. Mm-hmm. And
he
so
gave in a little.
Yeah, he gave me a little
in the back.
introductory massage. Yeah.
Right. Well, how about you? Have you had him give you a massage?
No, yet. No. I got to try
do
him.
that, right? Well, it's really a wonderful thing that you've taken on this great place. Yeah, I think it's funny when we talked about AGI. You started out with yourself and with Doctor. Your wonderful wife who was the dentist, and then you expanded slowly, and now you have 20 people who helped you.
Yeah.
And did you ever, in your wildest dreams, think that you would then have a spa? That wasn't one of your plans, was it? Come on.
No, not really. Just fell on my lap. Really, it wasn't something I was looking, for. But I do aesthetics, so it's sort of. I say, it goes along with what I do. And it's not something all the way out there to the left field.
It's not a plumbing company.
Exactly, exactly. So I think, it was okay.
No, it's a perfect thing. And, of course, Ina.
I have people that have offered me so many business to go into and what have you. Yeah. I remember one guy came with the escort service. And I say, wait a second. I don't think that goes right along with my field of work. So,
but you never know. Your elder patients are probably looking for someone.
Yeah, I mean, companion service. I can deal with.
Right.
But when you talk about escort, that's a different animal. I say no. I never use their service, and I don't think I want to get involved with that kind of stuff. So.
I don't think so anyway. But, I do remember some people who came to you with a certain kind of toilets. And
remember?
Anytime I find someone, anytime I find someone who has a good thing, I always say, let's go show it to Dr. Mencia, because then I know he will figure if it's good or not. He's got the sense about him. He'll be working with them, and then all of a sudden his eyebrows go up. Well, Dr. Mencia.
So for our listener, don't forget, please come and get a copy.
Oh, yeah.
When you come, get a copy at the office or the Boomer Time.
Right.
And go to page 4 and 5. Right. You're going to see the article by Dr. Ayala.
You're our main distribution point. Go to.
A lot of people come to pick up a copy. We think they're going to make an appointment. I just want a copy of the magazine.
Yeah. I know. When they say, where are you from? I'll say, we're over there on Commercial Boulevard. You're our new point.
I say, don't worry. Soon we're going to have a drive-through. So you can
That's fantastic. Pick up your magazine.
So that's part 1 of the article by Dr. Ayala on the heart. And part 2 is coming next month. Please get a copy.
It's so important.
Read it and save it for yourself and your loved one.
Yeah, that's really true. Well, Dr. Mencia, thank you. You of course, you always come here, Ina, but sometimes you just stay back.
She just smile.
Yeah.
She just smile. She talks when we're off the radio. When we're off the radio, she starts talking like a parakeet.
Undercover KGB. She's not a parakeet. No, she's great. She's pulled it
she's
all
Russian.
together.
She's Russian. So
Yeah,
now
she's
she's
Russian.
well accepted in the United States of America.
If you know what I mean.
Yeah, Putin than Ina.
Oh, my gosh. Well, thank you very much, and we'll see you again next week. Bye.
Thank you, Anita. Thank you, Ina.
Bye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.